Hey there, Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwalk, and New Canaan. Well, welcome to today's podcast. And what we're going to talk about today is something most people have never heard of. And we're going to, for now, we're going to call it your brain's very own cleaning crew. And what it's called, the true name is called the Glymphatic System. And it's like a garbage disposal for your brain. Now, here's the catch. It only works when you're asleep. And if this job doesn't do its job, this system, the waste products will build up and cause brain fog, poor sleep, headaches, and even contribute to serious issues later in life. So now here's the surprising part. The health of your neck, especially the base of your skull and your cervical spine, plays a major role in how well this cleanup system works. And like it or not, that's where chiropractic care comes in. So we're going to try to break it down today in plain English and explain how gentle adjustments can help your brain take the garbage and trash out every night while you sleep. All right. So it used to be thought that the central nervous system, which is stuff inside your skull, peripheral nervous system is everything outside the spinal cord, everything else down once you leave the occipital bone. You used to think that there was no mechanism to cleaning out the brain. It wasn't done. But in previous years, studies have really started to show the role that the garbage plays in stuff like Parkinson's, Huntington's disease, Creutzfeldt-Jakob disease. These are all terrible, with frontal temporal dysplasia, ALS, Alzheimer's, Parkinson's, all those bad things. And the proteins kind of bundle up, fold, and take up valuable real estate, which can contribute to brain fog if you're young, and also can contribute to these heavy-duty diseases as you get older. So the proteins are called beta amyloid, which forms plaques, and plaques aren't good. You don't want plaque in an artery. You don't want plaque in the brain cell. Now, you also have tau proteins. These are clearly linked to Alzheimer's. Now, another one is alpha-synuclein. Huntington protein is the one for Huntington's disease. The prion proteins are ones for Creutzfeldt-Jakob disease. And these are the main culprits behind most degenerative brain diseases. Now, I would be remiss if I told you chiropractic alone is going to be the answer to helping get the garbage out. And I help the cleanup crew do their job while you sleep. But sleep optimization is really, really important because this is when the body heals the brain at night. So, sleep posture is one thing. This can also enhance the efficiency of the lymphatic system. Physical activity is also another thing you can do on your own. Listen, if you're not getting blood flow to the brain, you're not helping yourself, and you're angling for more what we call comorbidities. And comorbidities early in life is brain fog, memory issues, all those type of little things that you just kind of pass off as aging when you really don't want to do that. So the physical activity is really important. You got to drive blood flow, and vigorous exercise is going to help improve the lymphatic function as you sleep. And what the thing here is, it's not a drug. I mean, if you heard somebody who has ALS or Alzheimer's, they want this miracle drug. But what you do, so that's where sleep is very, very important. It's of utmost importance. It's like, listen, diet, exercise, rest. Those are your common things that everyone knows they need to do, but they don't. But what happens is that we tend to take these different medications when you need it because that's all you know what to do. Not a good idea. I was just thinking too as we're going along. What I didn't mention is how lymphatic dysfunction is also an issue with post-stroke cognitive impairment, and that happens to most people with stroke. There's some long-term stuff going on there, and that's the vascular mechanisms where lymphatic function is positively associated with it. Sometimes people come back from strokes and in serious levels of cognitive decline. And there's also mechanical compression, okay? When you compress the brainstem, that's going to impede the ability for you to get good rest at night, but it's also going to make it hard for you to get that garbage taken out. And that's where the chiropractic adjustment comes in. It's the mechanical aspect. Surely there's a vascular mechanism to cognitive decline. Okay, we've outlined that. You got to exercise, you got to eat right, don't smoke, don't drink, and get the good night's rest. But, excuse me, the mechanical compression occurs at the base of your spine, at the base of the skull, the occiput. By taking tension out of the occiput by the chiropractic adjustment, you're really going to allow the system, the lymphatic system, to work better at night. And that's what you really want to do. Also, too, this is more anecdotally, but people do report better sleep, especially after chiropractic adjustments, if they have neck pain and headaches. So it's something for someone to consider as what you're not aware of, because if you have a little bit of brain fog, you go to your MD, and say, "Oh, you're just getting old." Do you really want to play that game? Do you really want to go down that road? Probably not. But I've had a number of patients tell me all of a sudden their head cleared after getting a good chiropractic adjustment to the occiput and to the cervical spine. Now, sometimes people are afraid, "Oh, I don't want my neck touched," or your doctor will tell you, or your medical doctor say, "Oh, don't let them touch your neck. The rest of the body's fine. Just don't do the neck." It's not a good idea if the neck is clogged up. You have a clogged drain. Are you going to call a plumber, or are you just going to let it stay clogged? Well, in this case here is, if you have a lot of tension in the occipital cervical region, you're going to have a blockage. And how do you get these proteins out of the body? Well, one, you got to get the good rest, you got to get the good exercise, the good nutrition, and you have to make sure that pathway is open. And that's what a chiropractic adjustment does. I know it's pretty self-serving for me to say as a chiropractor, but most people are not aware. They act on pain and pain alone. And when pain's gone, they think they're better. But in my 30 plus years of practice, I cannot tell you the number of people who respond favorably to a good, comfortable, okay? Because chiropractic care does not have to hurt. And some people are afraid of. In some cases, you will hear the bones move. But just imagine the blockage when those bones are twisted out of place. Not only the pressure it puts on the nerves that go to your arms and your legs, but also how it blocks and impedes the flow of the garbage at night. Okay? Most of the garbage come and pick up during the night. You don't hear them. They come and take out your garbage. Well, the lymphatic system needs to be working properly in order you get these amyloid and these beta, these different the tau particles out of the system at night. So I hope you've learned a little bit about it, and I hope it's not too self-serving what we're doing here. But don't discount the fact that a chiropractic adjustment to the occipital spine and cervical spine can have a positive impact on your overall health, but also here we talk about your brain health and potentially ward off cognitive decline. So if you have any questions, I'm Dr. Brian McKay, or Core Health and Dairy, and just give us a call. I'm more than happy to answer any questions for you. 203-656-3636. 203-656-3636. And if you're playing Scrabble, glymphatic is probably a good word no one knows, but now you know it, and hopefully you can educate other people about it. Again, thanks for listening. I hope you learned a lot. Bye now.